Hi, my name is Dr. Tabari, and I'm here to answer any questions or concerns about wisdom teeth. First, why should wisdom teeth or third molars be removed? Well, the first reason is that they should be removed if they cause pain for any reason. The second reason is that third molars erupt in weird angulations and weird configurations and may lead to damage of the adjacent teeth. The adjacent teeth is the second molar and is your functioning teeth. The third molars can themselves get infected and cause facial space infections if they're not treated in a timely manner. Third molars can cause gum inflammation and gum infection. This usually occurs when there is soft tissue covering part of the crown of the third molar. Sometimes an orthodontist requests to have third molars removed before or during orthodontic treatment to make space for the anterior teeth to move back if there is dental crowding. And rarely, third molars may be associated with benign cysts and benign tumors. Now, this brings us to the questionable reason of taking out third molars for the reason that they may cause shifting of the anterior teeth. And if they do that or not is questionable because it has never been proven in science. So the answer to that is that they may, although not directly proven. So now we come upon the risks of taking third molars out. Third molar removal is considered a minor surgical procedure. This is due to the fact that a lot of times it involves cutting gingival soft tissue and drilling bone to take out the third molars. So some of the risks that may occur include pain, bleeding, swelling, and minor risks of infection. Anatomically, there is a nerve in the lower jawbone that controls sensory information to the lower lip on that side. Now, the proximity of the roots of the third molars to that nerve determines the risk of damage or possible damage to that nerve. Although the risk is small, if that nerve gets injured, then the patient will suffer from paresthesia on that half of the lower lip. It is important to note, though, however, that this is a sensory nerve and it controls sensory information to that half of the lower lip, and it is not a motor nerve. Thus, there's no risk for a droopy lip. Sometimes the surgeon may order more imaging, such as a cone beam CT scan, to further elucidate the proximity of the roots of the third molars to that nerve. Another more rare injury is injury to another sensory nerve called the lingual nerve. This nerve runs just medial to the third molars under the floor of the mouth and provides sensory information to the anterior part of the tongue. Damage to this nerve may cause paresthesia to the anterior part of the tongue, and even more rarely may alter taste sensation in that region. If the nerve gets damaged, will it return again? Well, the nerve does have ability to regenerate. It happens more when the patient is young and healthy. And furthermore, it's a hard thing to predict. Usually the regeneration of the nerve takes in the process of months to years instead of days to weeks. And when regeneration does fully return, the nerve will function at about 70 to 80%. So now the question is, does every third molar need to be removed? And the answer to that is a resounding no. Sometimes third molars erupt like normal teeth and help with chewing of food and help with the patient's occlusion. Sometimes the risks of removing the third molars do not outweigh the benefits of removing them, especially when there's no pathology on the third molars and the teeth are asymptomatic. Thus, although similarities exist between third molars amongst patients, every situation is unique on itself, and the case to extract third molars should be discussed with the surgeon and the patient. This should involve a thorough informed consent between the surgeon and the patient before the procedure is to be undertaken. Well, I hope this answered some of your questions and concerns about third molars. Please leave any comments or questions in the comments section, and I will make a new video regarding popular comments or questions, and I will make further videos regarding other aspects of oral and maxillofacial surgery.